Hi, all. It's Jan from the Jan Files. I am, yes, I'm still raging, so just FYI. But one of the things I also want to make sure that people are aware of is the GOP attempts to try to rectify the subsidy situation with healthcare. And of course, they've had 15 years to do this. They've done nothing. They've had no plan. They still don't have a plan. They have pieces and parts of a plan. But I want to make sure that we understand at least my comprehension and listen, tell me if I'm wrong, because, I can be wrong, obviously. But I did print out something called Republicans' Common Sense Reform Will Lower Healthcare Costs. And it says they're going to lower the premiums, which they don't have. You know what? Here's the deal. These for-profit insurance companies don't have to do anything at this point in terms of lowering the premiums. Initially, you didn't want anything to do with that, did you? You didn't care if Americans had to pay higher premiums because the enhanced subsidies were cut. So, and you voted for all of that in the big, beautiful bill, and you knew this was coming. You knew this was part of the bill and did nothing within the bill to prepare for millions of Americans now not having any health care. And this idea, I have a little list here of the things they said they want to do. I'm not going to go through all of them. Stupid things like ending junk lawsuits. Like, yeah, right, that's going to save a lot of money. So now, establishing universal access programs to guarantee access to affordable care for those with pre-existing conditions. If I'm not mistaken, they used to do this. You used to have to find some place to go or some kind of group that would accept you based on your pre-existing conditions. Now, of course, with Affordable Health Care Act, they can't deny you for pre-existing conditions. So they can't, they don't, they won't. Now you're leaving that door open because this didn't work before. It ain't going to work now. And they're saying prevents insurers from unjustly canceling a policy or instituting annual lifetime spending caps. So, prevents insurers from unjustly. So what that means is they could cancel you, right? They could cancel your insurance, and then you'd have to prove that they did so unjustly. We already know what that looks like. We already know what that looks like because people all the time, put in for, care for cancer treatment or this and that, and they get denied. People have died because they've been denied by their health insurers. And that's something that needs to be fixed. It needs to be fixed. When you have idiots that have no medical background saying, no, you can't have this kind of treatment. So now if you hear a weird noise in the background, that's the heat going on. I'm in the basement, whatever. Encouraging small business health plans, encouraging innovative state programs. This is nothing. Encouraging means shit. Okay? And of course, they want to make sure that no abortions are paid for. They don't care if women die, period. Okay? They don't. And obviously, we're seeing with everything they do now, they really don't care about people losing their lives. They don't. Promoting healthier lifestyles. Okay, great. Now, this is the big one, folks. Enhancing health savings account. Now, your health savings account, I had one at one point. And, they took some money out of my pay and put it in there. It's non-taxable. And you could use that for, paying for different things that maybe your insurance didn't cover, like LASIK, like getting treatment for your eyes or something like that. And they say that instead of giving people the enhanced subsidies, okay, which depending on how big your family is, what that enhanced subsidy payment would be, they want to stop doing that, and they want to have you put that money they give you, instead of giving it to the insurance companies, they want to give it to you so you can pay for your health care yourself. So let's just kind of go over the average health care costs for people, or for a procedure, sorry. And so, okay, I got this here. I've done a double checking a little bit. This is AI, but we all know the range of different things. If you've ever had any kind of surgery, you'll kind of gasp about, the $11,000, $12,000, $13,000 it cost for, an hour procedure, right? You don't even have to stay in the hospital. So these are some of the common medical procedures and their costs. Now, they can be lower depending or higher depending on where you live. Like if you live in a major metropolitan area, obviously things are more expensive. If you live outside of that, in suburbia someplace, you're likely to see lower costs, okay? But just an x-ray, depending on what it is, can cost upwards of $1,000. And it could be less, but it can cost upwards of $1,000 for just an x-ray, okay? An MRI, depends on the body part, it says, but could be $3,000. CT scan, on an outpatient basis, can be $2,000. If you do it inpatient, like if you're in the hospital and they give you a CT scan, it could cost $5,000 to $7,000. An ultrasound can cost up to $1,000. A colonoscopy, at a minimum, is $1,000, can go up to $5,000. Blood tests, aren't that expensive, but still could be $300. And so I'm not going to go through everything here, but an appendectomy, let's see, which you don't choose, it chooses you, right? Anywhere from $15,000 to $30,000. So my point here is that, wait a minute, let's go to being pregnant and giving delivery. A normal delivery, vaginal delivery, can be as much as $11,000. And a cesarean section, you could be looking at $14,000. Now, there are many things on here I have had done. I've had an x-ray, I've had an MRI, a CT scan, an ultrasound, a colonoscopy, blood tests, emergency room visit, because I broke my wrist. And let's see, what else have I had here? Oh, thank God I haven't had any of these yet, but I certainly know that family members who have had gallbladder removal, which is $17,000, hysterectomy could be $22,000, and a biopsy, I've had that. Echocardiogram, I've had one of those. Physical therapy, yes, after I broke my hand. And so anyway, you get my point, right? Who the hell is going to be able to afford any of those procedures, even with subsidies? That's why you have health insurance, right? So ultimately, this still is not, there's nothing that's etched in stone. But this HSA, like, we're going to give you your money. We're going to give you so you can make your decisions. What? How is anything the government is going to give you going to cover any of those, even if they lower the prices? Even if they say, okay, you don't have health insurance, we're going to knock off a couple $1,000 of it. Who can afford that? If you're wealthy, you don't have to worry. You're not interested in this conversation anyway, right? But for those of us that rely on health insurance because we need it, because we can't afford to cover these things, this is an abomination. I mean, really? I looked up like what a broken wrist could cost. It could be upwards of $14,000. I haven't looked at my bill. I should look at my bill for what was paid when I had surgery, because I had to have surgery. Ooh, look, see, there's my, can you see my, where is this here? Oh, scars here, right? Whatever. Anyway, you need, there is no sense to any of this. Okay? It doesn't make any sense. This is not going to do Americans any good. To suggest that it would is just another attempt to screw you. They don't care about you. And if you haven't figured that out yet, I don't know what you're doing. Okay? Because they don't. They don't care. They have this false sense of, I don't even know what it is anymore. I don't think they really think they're doing any good for the American people. I think they're just focused on pleasing Trump and keeping power. So that's what it's about. It's not America. It's not about making America great. It's none of those things, or putting us first, because we just spent $1 billion going into Venezuela, but we have people who can't afford their health care. So there is no America first or Americans first. This is Trump. This is Trump, who is now talking about going to land in Mexico. I don't know what MAGA's thinking. I don't care. I don't actually think they think. I think they walk around with their head up their ass most of the time. So I have zero respect. But folks, you got to keep talking, keep spreading the word, keep spreading the facts. And like I said, there's no plan etched in stone, but this is one of the things they've been talking about. And it's here. It's on that list I showed you. So share. Yes, we have to keep focused on everything, right? We have to look at ICE every goddamn day, because they're shooting American citizens. They're taking citizens out of the country who are in the asylum process, which is illegal. You don't get to do that. That is against the law. They're doing it anyway and lying about it, okay? And on the Epstein front, we've got some more witnesses being called, but there are lots of other witnesses, and that reminds me, I got to make some calls today to remind those people. I think it's Garcia, Rocana, Massey, and some others, that there are other important people, civilians, that need to be called, who have a lot of information, because they were Epstein's assistants. So I'm also going to put a link in my, wherever you see this, you'll see a link to one of my really in-depth Epstein posts on YouTube. So I hope you check that out. I hope you subscribe to this channel. I'm going to try to turn this more like into a daily what's up thing, as well as do more extensive, in-depth things, which I will do once we see if we have a different healthcare plan. I will then go in and look at it and, give you my thoughts and the facts that I have been able to round up. Oh shit, hang in there, everybody. Okay, this again is Jan. Please subscribe, follow me. We need to keep talking about this, all right? And not accepting any bullshit, and you need to make calls. I'm not the only one saying do that. Heather Cox Richardson said, put the pressure on. Have a good day.